All right, let's take a deep dive into something, well, pretty fundamental, breathing. And specifically, how lung care is really being transformed in Kolkata, a place where, let's be honest, breathing easy isn't always a given.
No, it really isn't. And it's such a timely topic, isn't it? With urban air quality being a constant concern. And, well, recent years have really hammered home just how vital our lungs are. They're working nonstop.
Incredible machines, really. Oxygen in, CO2 out,
Yeah.
day in, day out. But yeah, pollution, illness, things can go wrong.
They certainly can. And in Kolkata specifically, you've got that mix. The WHO highlighting air quality risks, the humidity, the traffic fumes. It puts a real strain on people's respiratory systems. It's a very present issue there.
Absolutely. So what we want to do today is explore some of the really cutting-edge medical tools being used right there in Kolkata at a leading hospital, how they're changing the game for diagnosing and treating lung problems. It's actually quite amazing.
It really is. Applying these advanced techniques where they can make a tangible difference for people.
So, okay, where do we start? How do doctors even, get a look inside, see what's happening deep in the lungs or the chest?
Right. Well, one of the main tools for looking inside the airways themselves is called a bronchoscopy.
Bronchoscopy. Okay, so it's like sending a tiny scout in.
Kind of. It uses a bronchoscope, which is basically a very thin, flexible tube.
Hmm.
Think maybe pencil width. It's got a light and a tiny camera on its tip.
And where does it go?
It's carefully guided, usually through your nose or mouth, down your windpipe, and then into the branching network of airways inside your lungs. It gives the doctors a direct view. They can literally see inside.
See exactly. What are they looking for?
Oh, signs of infection, maybe inflammation, any unusual growths, or sometimes even things people might have accidentally inhaled. You'd be surprised.
But it's more than just a camera, right? They can actually do things with it.
Exactly, that's key. It's also a therapeutic tool. They can pass tiny instruments through it to, say, clear out a blockage, or take a very small, precise tissue sample, a biopsy, to figure out exactly what's going on.
Biopsy. Okay.
Or even place tiny supports called stents to help keep an airway open if it's narrowed.
Now, I imagine for you listening, the idea of a tube going down there, it might sound a bit daunting. What's the actual experience like?
That's a really common concern, and yeah, totally understandable. But it's managed very carefully. You're given a mild sedative so you're relaxed, comfortable. Often people feel like they're just having a light nap.
So you're not fully knocked out?
No, not general anesthesia, just nicely sedated. And they numb your throat, too. The whole thing usually takes maybe 30 to 60 minutes, and most people go home the same day. You might have a bit of a sore throat after, but generally, it's not painful.
And it's safe?
Very safe, yes. Considered minimally invasive, that lack of general anesthesia is a big advantage for recovery.
Okay, so that covers the view inside the airways. But sometimes the problem isn't in the pipes themselves, but in the space around the lungs.
That's right. That's the pleural space, the area between the outside of the lung and the inside of the chest wall. Think of it like the lining or the cavity the lungs sit in.
And issues can crop up there.
Definitely. Fluid can collect there. That's called pleural effusion, or sometimes air can leak into that space. Both cause breathing problems. And for looking into that area, doctors use a thoracoscopy, sometimes called chloroscopy.
Thoracoscopy. Okay, different approach then.
Yes. Instead of going down the windpipe, they make a very small incision, usually between the ribs. And through that, they insert a thin, flexible scope with a camera, the thoracoscope, into that pleural space.
And what can they see or do there?
They get a direct look at the surface of the lung and the lining of the chest wall. They're looking for inflammation, infection, signs of cancer. It's especially useful for figuring out why fluid has built up.
So investigating the cause of that effusion.
Exactly. And like bronchoscopy, it's not just for looking. They can drain off large amounts of that fluid, which gives immediate relief. They can take biopsies from the lining tissue.
To diagnose.
Right. And they can even instill medication into the space to try and stop the fluid from coming back. It's called pleurodesis, much more targeted than older ways of managing it.
And I'm guessing this is also minimally invasive.
Hugely so. Compared to traditional open chest surgery. Much smaller scars, significantly less pain, and way faster recovery. It's really changed how these pleural conditions are managed, more like keyhole surgery.
This really underscores something critical, doesn't it? The importance of catching these problems early.
Oh, absolutely critical. This is where these tools become potential lifesavers, especially with something like lung cancer. Early detection versus late detection. It's a completely different ballgame.
Yeah, lung cancer is notoriously sneaky, isn't it?
Yeah.
Often no symptoms until it's quite advanced.
That's the problem. By the time you have a persistent cough or shortness of breath that makes you see a doctor, it might already be stage 3 or 4. It can spread silently.
And the numbers in India are serious.
Very serious. It's a leading cancer, over 70,000 new cases a year. And look at the survival rates. If you catch it early, stage 1, the 5-year survival can be 60% or even higher. But if it's found late, after it's spread, it drops below 10%. It's a stark difference.
So tools like bronchoscopy, thoracoscopy, maybe combined with scans,
Yeah.
they're key to finding it early.
Absolutely vital. Finding it when it's small, localized, and much more treatable.
And it's not only cancer, right? What about things like COPD, chronic obstructive pulmonary disease?
Right. COPD affects millions in India, too. Smoking is a big factor, but also air pollution, things you're exposed to at work. It basically makes it hard for air to move in and out of the lungs, like constant traffic jams in your airways.
And do these procedures help with COPD management?
They can play a role. Bronchoscopy might help assess the airways, rule out other things. And thoracoscopy can be crucial for managing complications like those pleural effusions that can sometimes happen in severe COPD. They're part of the diagnostic and management toolkit.
So let's bring it back to Kolkata. We mentioned a leading hospital there, Apollo Multispeciality Hospitals. What makes their setup stand out?
Well, several things. Firstly, they have JCI Accreditation Joint Commission International. That's a really tough global standard for quality and safety. Being the only one in Eastern India with it says a lot about their processes.
Like a gold star for hospitals?
Pretty much, yeah. It's a big deal internationally. And then there's the technology they're using.
What kind of tech?
State-of-the-art stuff. They mentioned ultra-thin bronchoscopes, which can get into smaller airways. But a real standout is their use of EBS endobronchial ultrasound.
Okay, break that down. How's it different?
Think of it like bronchoscopy, but with superpowers. The scope has a small ultrasound probe on the tip, so the doctor isn't just seeing the inside surface of the airway.
They can see through the wall.
Exactly. They can visualize structures outside the airway wall, like lymph nodes nearby or tissue deeper in. The ultrasound gives them this extra layer of vision.
Wow. And why is that so important?
It's a game changer for diagnosis and, crucially, for staging lung cancer. Doctors can see suspicious lymph nodes that a normal scope couldn't reach, and then use the ultrasound in real time to guide a needle precisely into that node for a biopsy.
So incredibly precise sampling.
Extremely precise. Getting samples from the right lymph nodes tells them exactly how far the cancer might have spread, which is fundamental for planning the right treatment. EBUS is really key for that.
Amazing tech.
Yeah.
But tech is only as good as the people using it, right?
Spot on. And the expertise of the team there is clearly a major focus. They highlight skilled pulmonologists, mentioning people like Dr. Debraj Josh, described as a gold medalist, highly experienced, performed thousands of procedures. Apparently, he even pioneered bronchial thermoplasty in the region.
Bronchial thermoplasty. We should come back to that.
It definitely should. But having that level of expertise, people who are not just skilled, but are actually advancing the field, that builds huge confidence.
Makes sense. And they also seem tuned into the practical side of things. Life in a busy city.
Yeah, I thought that was quite considerate. They offer evening clinics, 5 p.m. to 8 p.m. on weekdays, and even Sunday morning clinics. Recognizing that people have jobs, lives, making it easier to actually get the care you need. It shows they're thinking about the patient's reality.
Okay, let's tackle that fear factor again. Because even with all this reassurance, scope in the lungs still sounds inherently uncomfortable, maybe even scary for you listening.
It's a natural reaction, absolutely. Nobody wants a procedure like this. The idea itself can cause anxiety.
So what's the counter-argument to that fear?
It's really about understanding the reality versus the fear. The sedation makes you relaxed and unaware. The numbing agent works well. It's monitored closely. Is it pleasant? No. Is it generally painful? Also no. The actual discomfort is usually minimal.
And the safety record.
In experienced hands, like the teams we're discussing, these are very safe, routine procedures. Serious complications are rare. Patients worry, of course, but the reality is it's generally smooth.
So it boils down to a choice, doesn't it? A short period of mild discomfort and awkwardness
versus letting a potentially serious lung issue just grow unchecked. When you frame it like that, the procedure seems like the much, much better option. And knowing the team is highly skilled makes a big difference to that anxiety.
We've touched on treatment, but let's emphasize that these aren't just diagnostic tools. They actively fix things too.
Absolutely. Bronchoscopy to clear blocked airways, thoracoscopy to drain fluid and treat the pleural space. These are direct interventions.
Any other specific treatments done via these scopes?
Yes, definitely. During bronchoscopy, they can use tiny balloons to gently stretch open narrowed airways balloon dilation. They can place those stents we mentioned, tiny scaffolds to keep airways open. And EBUS, again, that precise biopsy capability is crucial for staging cancer, which directly informs treatment.
Right. And you mentioned bronchial thermoplasty earlier. Tell us more about that. Pioneered by Apollo in eastern India, you said.
Yes, back in 2022. It's a really interesting treatment specifically for people with severe asthma that isn't well controlled by standard inhalers and medications.
How does it work? You called it a spa treatment for airways.
Huh. Well, sort of. It uses controlled radiofrequency energy heat, essentially, delivered through a special catheter during a bronchoscopy. This heat gently reduces the amount of excess smooth muscle in the airway walls.
And it's that muscle that causes the problems in asthma.
That's the muscle that tightens up and constricts during an asthma attack, making it hard to breathe. So the idea is to reduce the amount of that overactive muscle.
Is it a one-off treatment?
It's done in 3 separate sessions, usually about 3 weeks apart, treating different parts of the lungs each time.
And does it work? What do patients experience?
The results seem very positive. Patients report having fewer severe asthma attacks, needing less emergency treatment or rescue medication. Ultimately, it means a better quality of life, being less limited by their asthma. You hear about people being able to be more active, climb stairs easily, just breathe better day to day.
That sounds truly life-changing for someone with severe asthma.
It really can be.
So, zooming out again, what's the bigger picture here? Having this level of advanced care available in Kolkata.
It's hugely significant. Lung disease doesn't discriminate, it affects everyone. But in the specific context of India, with challenges like air pollution being a daily reality, plus ongoing issues like TB, having accessible, cutting-edge diagnostics and treatments is vital. Early detection, effective management, it's a lifeline.
It moves beyond just the technology, doesn't it? It's about the human impact.
Completely. These procedures, this expertise, it translates into people getting back to their lives. The rickshaw driver breathing easier, the teacher managing the stairs, the grandparent keeping up with the kids. It's about restoring function, restoring hope.
And it sounds like the approach there combines that high-tech capability with genuine patient care.
That seems to be the key message coming through. Advanced technology delivered with empathy and accessibility.
So for you listening, maybe in or near Kolkata, maybe worried about a cough or breathing issue,
Yeah.
what's the main takeaway message?
Don't ignore it. Don't wait. Lung problems can be sneaky, as we said. But the tools exist now to get clear answers and effective help, often minimally invasively. Places like Apollo in Kolkata have the technology and the expertise. Getting checked is less daunting than you probably imagine.
And they've made it convenient, too, with those flexible clinic hours.
Exactly. The Kankargaji campus, 58 Canal Circular Road. Or check their website. Taking that step, making that appointment, it could be the most important thing you do for your health if you have concerns.
It really makes you think, doesn't it? In a place facing environmental challenges like air quality, having this focused, advanced medical capability right there, it highlights that maybe the greatest luxury isn't something material. Maybe it's just the simple, profound ability to take a deep, easy breath.